Hello everyone, my name is Sanjana Kanodia and I'll be starting our presentation on elder abuse and neglect in Canada, a community assessment. So, our focus is on elder abuse in community and institution settings. Why elder abuse? Because elder abuse is an important and growing public health concern that affects older adults across different care settings. Despite its seriousness, it often remains hidden and under-recognized. In today's presentation, a group will explore the elder abuse in both community and institutional settings, including the private homes and long term care facilities. We'll also focus on the role of nurses in identifying signs of abuse, supporting affected individuals, and advocating for safer environment. Now I'll talk about the rationale for selecting this population. We chose this population because elder abuse is significantly underreported in Canada, making it hidden and a critical issue. Many older adults may not even report abuse due to fear, dependency of caregiver, or lack of awareness about the system. Older adults, especially, are vulnerable due to factors such as physical frailty, chronic health conditions, cognitive decline, which lessens their ability to seek help. In addition, risk factors like social isolation, caregiver stress, dependency further increases their vulnerability to abuse and neglect. This topic is highly relevant to nursing practice, and nurses have a professional and ethical responsibility to advocate for vulnerable population and ensure their safety and well-being. Let's talk about the prevalence and types of elder abuse. In Canada, there are approximately 7.3 million older adults, making a significant portion of the population. Studies estimate that between 4 to 10% of the seniors experience abuse. However, the actual number is highly higher due to the underreporting. Let's talk about the types of elder abuse. Elder abuse can occur in different forms, including physical abuse, emotional or psychological abuse, financial exploitation, neglect. Each type of abuse have a serious physical, emotional, and psychological consequences for older adults. Understanding the prevalence and different form of elder abuse is essential for early identification, prevention, and effective intervention by the healthcare professionals.
Hello everyone, my name is Kushi Kashyap and today I'm going to discuss about community assessment approaches. Community assessment is an important step which helps us to understand the needs of older adults who are at risk of abuse. In this case, we are using three main approaches. The first is the need of assessment. It helps us to identify the gaps in services and what support does the seniors require. The second is the windshield survey, where we observe the community environment, such as housing conditions and available resources. Third is the key informant interviews, where we gather insights from healthcare professionals or community workers who work directly with the older adults. We also use secondary data sources like national reports to understand trends at a larger level. Overall, all these approaches helps us to identify risks, available resources, and areas where intervention is needed. So, in this slide, I'm going to talk about assessment tools and data collection. To support our assessment, we use specific tools and data collection methods. One key tool is the Elder Abuse Suspicion Index, or EASI, which helps in early screening of possible abuse. Data is collected through observation, interviews, and clinical assessments. For instance, nurses may observe physical signs, behavioral changes, or emotional distress. We also focus on identifying risk indicators such as isolation, caregiver stress, or cognitive decline. This process helps ensure that cases of abuse are identified early and that individuals can be referred to appropriate healthcare and community services in a timely manner. In this slide, I'm going to discuss about the rationale for mixed methods approach. We chose a mixed method approach because it provides a more complete understanding of elder abuse. This approach combines quantitative data such as statistics and reports with qualitative data like personal experiences and interviews. Quantitative data helps us understand the scale of the issue, while qualitative data gives deeper insight into what older adults actually experience. Key data sources include organizations like Statistics Canada, PHAC, and CIHI, which provide reliable national data. By combining both type of data, we can create more accurate evidence-based assessment and develop better strategies for prevention and intervention.
Hello everyone, my name is Fatima Patel and I'm going to continue our presentation further. On this slide, we are looking at both the strengths and the challenges within the system related to elder abuse in Canada. Starting with the strengths, Canada has established legal protection in place to safeguard older adults from abuse. These laws help guide reporting and intervention when abuse is suspected. There are also community and healthcare support services available, such as social workers, nursing care, and community organizations, which provide assistance and protection for older adults. In addition, there is increasing awareness about elder abuse nowadays. More education and public health campaigns are helping people recognize the signs and understand the importance of reporting. However, despite these strengths, there are still significant challenges faced by elder abuse. One major issue is that elder abuse is underreported. Many older adults may feel afraid, dependent on their caregiver, or are ashamed, which prevent them from speaking up when they are abused. Another challenge is social isolation, especially among seniors who live alone or have limited social support available. This increases their vulnerability to abuse and neglect. Lastly, it can be difficult to identify abuse, particularly in clinical or institutional settings. Signs may be subtle, misunderstood, or hidden, making it harder for healthcare professionals to detect the sign. Overall, while there are strong systems in place to support the elder abuse, these challenges highlight the need for improved awareness, early detection, and supportive intervention. On this slide, we are looking at the key stakeholders and gatekeepers involved in elder care. First, stakeholders are individuals or groups who are directly involved in or affected by elder care. These includes older adults themselves, their families, and informal caregivers, nurses, and other healthcare professionals involved in care, and also community organizations. Each of these groups plays an important role in either supporting or influencing the well-being of older adults. Now, when we talk about gatekeepers, we are referring to people who either facilitate or restrict the access to care and support services. For example, healthcare providers like nurses act as positive gatekeepers because they help identify abuse, provide care, and connect patients to appropriate resources. However, in some situations, caregiver or family members may act as negative gatekeepers. They may control the older adult's communication, prevent them from seeking help, or even hide signs of abuse. This is important for nurses to recognize because understanding who has control over access to care can help us identify potential risks and intervene appropriately. On this slide, we focus on populations whose voices are often overlooked in elder care. Firstly, older adults with dementia or cognitive impairment may have difficulty in communicating or reporting abuse. This makes them especially vulnerable and dependent on healthcare providers to recognize signs of harm. Secondly, seniors who face language or cultural barriers may not feel comfortable expressing concerns or may not fully understand their rights and available resources and services. Cultural stigma can also discourage reporting abuse. Thirdly, LGBTQ plus older adults may experience discrimination or fear judgment, which can prevent them from seeking help or disclosing abuse to others. As nurses, it is essential that we provide culturally safe, inclusive care to older adults and person-centered care. This means using clear communication, being respectful towards them, being respectful of diverse backgrounds, and creating a safe environment where all patients feel heard and supported. Recognizing these overlooked voices help ensure that no one is left behind in care.
Hello everyone, my name is Ramya and I'm going to discuss about the methodological strength and limitations. The strength are that the multiple data sources helped to improve the reliability and the validity of the assessment. Mixed methods help to improve the in-depth understanding of the issue. Community-based approaches enhances the real-life context and the stakeholder engagement helped in better understanding of the elderly abuse. The limitations are that elderly abuse often gets unnoticed or underreported, and the cultural stigma may prevent the disclosure. Some vulnerable groups are very hard to reach, for example, isolated seniors. Findings may not fully represent all the elderly population of the community. Now, is the gaps and the additional strategies. Gaps in the strategies are that there are there are very undetected or underreported abuse cases. Limited insight is into the isolated or cognitively impaired elderly patients. There is lack of understanding of the long-term abuse patients. The additional strategies which can be used are there is a use of health or police record for data triangulation, for example, for cross-regional sampling, longitudinal studies for tracking over time, community mapping can be done of high risk areas, anonymous reporting system, and the digital data collection tools, for example, electronic health record or the tele records. Ethical considerations and nursing advocacy. The ethical principles which are very important are autonomy, dignity, confidentiality, and the informed consent related to the care. Also, the healthcare professionals have a very important duty to report any kind of a suspected case. Nurses play a very important role in early identification and diagnosis, advocacy, and protection of the patient from any kind of abuse, promoting safe care environment, and also in promoting justice and equitable care to the older adult and the vulnerable population, empowering clients through education and making them aware about their rights. The conclusion is that elderly abuse is a very complex and a growing concern in Canada. It remains underreported in both community and institutional settings, for example, long term care or resident home. Nurses play a very critical role in this because they are providing direct care to the patient and they're very close to them. They play an important role in early diagnosis and detention, in prevention strategies, and advocacy and intervention. Strong community assessment supports improved safety and quality life. What we as a group learned from the community assessment is that older adults are vulnerable due to dependence, isolation, declining health, and underreported abuse in community and institutional settings. Also, in relation to the group work, we realize that communication, task sharing, time management, accountability is very important. These are the references which we have used.